Hi, good morning Ted. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of July 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Ted Warner.
And what is your candidate number, please?
My candidate number is 260342219.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
That's all right.
How do you handle workplace stress?
Work becomes hectic very often as a nurse. I have attended some workshops on work-life balance, which trained me in dealing with stress. Apart from that, I wake up early to stretch my body and do meditation to prepare for the day. I try out new cooking recipes in my spare time while listening to music. I make sure that I take sufficient time out on weekends for recreational activities at home or with friends. When work becomes intense during peak hours, I perform simple breathing exercises to calm myself down.
Describe how you manage a busy workload.
Whenever there are too many tasks ahead of me in a shift, the first thing I do is to make note of it. Then I will prioritize my tasks. Afterwards, I sit with the other nurses to split all our tasks into smaller components and handle them one at a time. Usually, we devise a workflow where a single person handles similar tasks. This way, we increase speed and efficiency by working in groups and delegating tasks effectively.
How do you handle a situation where your replacement does not arrive on time?
I will contact my replacement roughly an hour before my shift ends to ensure that they would arrive on time. If they communicate that there might be a delay or absence, I help them find a substitute to take their shift, or inform the senior nurse or doctor when I cannot find a substitute. In either case, I make sure to not leave my post until my replacement arrives.
How do you handle a crisis or an outbreak?
During the COVID-19 pandemic, like all departments, mine felt the pressure too. Our team had to work extra shifts to cover absences caused by staff members testing positive. While that was a challenge, we pulled together as a team and supported each other. Also, my manager put me in a busy ward with new inpatients. I was charged with collecting details of family members and general health care of those with the virus. We were well versed and took all the precautions like PPE to wear and other safety processes.
Do you work well with other team members?
One of the biggest lessons I've learned working in a busy ER unit is the importance of communication. The moment new patients come in, we need to assess their priority levels and needs quickly. There's not a moment to spare. I pride myself on my ability to effectively communicate well with doctors, nurses, and other medical staff. The number one priority is always delivering the most appropriate care to each patient. I've learned that it takes a level of flexibility. By working alongside doctors and listening to their expert advice, I am able to offer the highest level of care and help to each one.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. Now you can start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Hello! Good morning, Mihiraa. I am your attending nurse, Ted Warner here. How do you feel about endoscopy?
Good morning, Ted. I am worried about the endoscopy. Mainly concerned, how painful will it be?
Mihiraa, your worries are quite natural. Don't worry, I will give you the information about endoscopy. So, your worries will be settled.
All right, you may please help me, nurse.
Of course. Endoscopy is a short procedure, of duration of around 15 minutes. Before the procedure, you will be sedated with local anesthetic throat spray, to numb the area. As a result, you will experience only very little pain. Also, there will be some minor discomfort afterwards.
All right, I got it. And, nurse, I would like to know what I should do to prepare for the procedure.
I appreciate your consciousness, Mihiraa. I will explain to you the preparations needed for the procedure.
Please guide me, nurse.
Mihiraa, it is important to avoid consuming food after midnight, to get rid of risks. Perhaps, you can have clear liquids, up to 6 hours beforehand, so no worries about dehydration. With that being said, I would like to know about your current medication.
No, nurse, I am not taking any medications. But I don't really understand why I can't have an early breakfast, as my endoscopy is scheduled for the afternoon session.
Your thoughts are reasonable, Mihiraa. Let me tell you the need for pre-procedure fasting, so that it will be clear to you.
Yes, nurse.
The importance of avoiding food is to eliminate the risk of aspiration of food or drink into the lungs under sedation. Apart from that, to ensure a good view for the doctor, to make a definitive evaluation, it is important to be nil by mouth. I hope now you understand the importance of fasting.
Yes, I understand that, nurse. I will do it accordingly.
Well, Mihiraa, I can provide some suggestions about what you can have for breakfast on the day of the procedure.
Okay. Let me know about it.
Mihiraa, it is okay to have black coffee or tea in the morning, and can take apple juice as well.
I understand that, nurse. I think it is better that I will only have black coffee for the breakfast.
Thank you for your understanding, Mihiraa. Do you have any other questions that I need to clarify?
Yes, I do have a question. Nurse, I am worried. I am curious to know if there are any risks to the procedure.
Mihiraa, your concern is understandable. I will explain to you what the procedure involves.
All right.
First, to clarify your worry, complications are actually very rare to happen. That is because we will be monitoring you before and after the endoscopy. Thus, I can reassure you that the chance of complications is very less. If you require more clarity, more information will be available from the doctor.
It's okay, nurse. Now, I feel more reassured now. But I would like to know how long the recovery will take.
Definitely, Mihiraa. Let us discuss what to expect post-procedure. There will be mild discomfort in the throat for a few days, which will subside naturally. You also require rest after the procedure. However, you will have a quick recovery, and your discharge will be on the same day as in the normal scenario.
All right. That's fine.
Beyond that, there will be some after effects of sedation and throat spray. Nothing to be overly concerned about it. As a result of the sedative effect, you will feel some drowsiness. Therefore, it is essential that you need to arrange for someone to take you home. You can arrange any friends or relatives.
Okay, no worries. I will arrange for someone to take me home.
All right. That's good, Mihiraa. I hope I have cleared all your concerns. If you have any further questions, always feel free to contact us.
Sure, nurse. I will. Thank you for your explanation. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.